regularly get mood swings that make you happy and suddenly start feeling sad without a probable cause? If you are among those women who want to strengthen their lives and go through its challenges successfully, then this episode of Health Point is for you. My name is Anahis Patel, certified health and nutrition coach, and let me welcome you to Health Point, a short 5-minute show that brings you meaningful health and wellness tips from reputed doctors. Premenstrual syndrome, or PMS, is a common health problem in women of reproductive age. PMS occurs during the luteal phases of menses, generally 15th to 28th day, but disappears with menstrual flow. The prevalence of PMS has been reported in 20 to 32% of premenopausal and 30 to 40% of the reproductive female population. Changing hormones are considered to be responsible for many uncomfortable or unpleasant period signs and symptoms, like cramps and tender breasts. We have with us Dr. Hrishikesh Pai, President of the Federation of Obstetric and Gynecological Societies of India, or commonly known as FOGSI. So, let's understand more about premenstrual days in detail from Dr. Pai. So to start, could you explain what PMS is and what its symptoms are?
PMS or premenstrual syndrome is a set of physical and mood changes that many women experience about 1 to 2 weeks before their menstrual period begins. These changes are linked to fluctuations in hormone levels, specifically estrogens and serotonin.
That makes sense. You also mentioned that PMS symptoms can vary. So could you describe some common emotional symptoms?
PMS symptoms are indeed different for every woman and can change throughout their lives. Common emotional symptoms include irritability, anger, depression, crying spells, oversensitivity, nervousness, anxiety, and alternating feelings of sadness and rage.
My next question would be, does PMS continue into menopause, and how do women manage it?
PMS usually stops after menopause when a woman no longer gets a period. However, during the years leading up to menopause, hormonal fluctuations can continue and may cause similar mood changes.
Of course, so you mentioned diet. Are there any specific dietary recommendations for women who PMS a lot?
Yes, diet plays a very crucial role. Studies have shown that calcium supplements, about 500 milligrams twice daily, can significantly reduce PMS symptoms like fatigue, craving, and depression. Calcium-rich foods like dairy products, fortified foods, and supplements can be beneficial.
So finally, for women with severe PMS, what treatment options are available?
For severe cases, medication may be necessary. Over-the-counter pain relievers can help with physical symptoms like cramps and headaches. Prescription medicines and hormonal birth control may also be considered.
Thank you, Dr. Pai, for your insights into PMS and its management. Your expertise is truly appreciated. Now let's see what our other doctors have to say about this.
Women can present with variety of symptoms such as fluid retention, which will give them abdominal bloating, weight gain sensation, breast swelling, tenderness. Sometimes there can be increased appetite, food cravings, especially for the salt and sugar. So many other symptoms like lethargy, fatigue, and lack of energy.
Premenstrual syndrome, commonly known as PMS, refers to the physical and emotional symptoms that some women experience in the days leading up to the menstruation. PMS symptoms can impact the quality of life. The best method for determining PMS pattern is to track the symptoms in a personal diary for 2 to 3 months. The symptoms need to be divided into physical, such as bloating, headaches, weight gain, aches and pains, breast tenderness, fatigue, lack of energy, and emotional symptoms.
So remember, the premenstrual symptoms are common. And it's not your fault. Do consult your doctor for treatment options tailored for you. That's all for now. See you next week. And don't forget to keep it healthy.